part is we start with a little bit of numbing. And again, our patient is pretty awake, just with a little mild sedation. And again, we just numb up the areas behind the ear and under the chin. Okay? Starting with Vaser here, and again, Vaser's our little probe here that allows us to melt this fat and have controlled energy, okay? So we are using a flat cannula, and you can see it only has a hole on the underside. That way when I do this, I'm leaving things as smooth as I possibly can to make sure that I'm only getting the fat that's right next to muscle. And then everything else will stay nice and smooth above it, okay? Guys, the important part about this is obviously making an incision that's super hidden, so we only use one stitch to basically close up this little hole here. And again, in her case, it was an old scar, but that's it. And usually this is like a scar that disappears where you won't see how small it is. And that's it. So we're gonna do the buccal fat pad, and what I want you to notice is, see this thing right here? That's where saliva comes out, okay? That's the duct that we don't want to mess with. So we literally inject right below, and we put some numbing medicine in there. And then we put some little bit at the top, and that's it, okay? So here's one side. And again, hers is very loculated, meaning it's got different chunks. You can see all this is bulging out, okay? Again, this one doesn't want to come out. It's like little chunks. See, and it just wants to go back in. You can see it wants to go back in. Okay, that makes me feel better. That's the same size. So we are done, and again, if you come over here from the top, you can see where we got rid of the buccal fat pad here. And again, we slimmed her jawline down here, okay? But that's basically it. And again, this is not so much a show and tell surgery. It takes time to see those results, all right?